billion for couples.
They're also talking about eliminating Medicare and Medicaid fraud, something that has so far been very difficult to do. So is all this realistic? We welcome Republican Representative Phil Rowe of Tennessee and Democrat Anthony Weiner from New York. And Anthony's got his coat off. He's ready for a fight, I can see. Good to see you both, gentlemen.
Look at him. He's like...
Remember, we have a doctor there, so if anybody gets cut, we can fix it. Dr. Phil Rowe, let me talk to you first. What is in these extra 900 pages in the Pelosi bill?
Well, let me just show you right here. I brought it with me, and let's get a look at this thing. This is the bill right here.
Whoa, you killed a tree.
And this, several trees, I think. Let me put this out of the way before I get a hernia and have to be operated on. In this particular bill, what we're looking at and talking about is that we're looking at $400 to $500 billion coming from our Medicare program, when we're adding 3 to 3.5 million beginning in 2011. The baby boomers hit with a tidal wave. So we're in 10 years are going to remove $400 to $500 billion, and we're going to add 30 million people to the plan. Now, secondly, and this is what I don't understand about this accounting, and again, I'm new here, I've only been here 10 months, but this is what I don't, we're ignoring history. And let me just explain some history to you. In 1965, the Medicare plan was a $3 billion to $4 billion program. The CBO, the folks in the government, estimated by 1990 it would be a $15 billion program. Guess what it was? $90 billion, and it's $400+ billion today. TennCare, we had the very same issues in Tennessee then. We had ever-rising costs, and we were going to control those costs with managed care. Well, guess what we did? In 10 years, we tripled the cost to our
Let me get
folks.
Representative Weiner in here. There are some compromises in this plan, but let's talk about the cost itself. It's just under about $1 trillion. Is that too expensive? And paying for it by, I believe it's taxing 0.3%, the very wealthy, as they would call it, but $500,000 or more to the upside. Talk to me about, how Americans should swallow that.
Well, frankly, you've got to look at the alternative. The alternative is next year your insurance, my insurance, and all your viewers' insurance is going to go up about $1,000. That's what it did last 4 years. It's going to go up about that much again. Right now, we pay $2.7 trillion each and every year for health care, and a lot of it, frankly, is money we shouldn't have to pay, and we still don't get the care that we should, and people aren't covered. So that's the alternative. The status quo is simply not acceptable. And it is true, we are going to ask people who are very wealthy to pay a little bit more, but let's remember something. Of all the people that are going to benefit, people that invest in stocks, invest in businesses, those businesses are going to be a lot more competitive now because they're not going to have to shoulder, hopefully, the rising cost of health care that we're going to try to contain under this bill. The status quo simply is not sustainable. I know there are a lot of people that want to keep going in this direction, and maybe my friend here is not one of them, but frankly, we can't afford to let that keep happening, and that's why we're taking on this challenge.
Dr. Rowe, one thing that the middle class has benefited from in the past, maybe one of the only things, is flexible spending accounts. Open enrollment is beginning across the country next week. Flexible spending in the Baucus bill was going to be cut in half. Now you can put aside $5,000 in pre-tax income to pay the way you want in health care. According to the Baucus plan, it's going to be cut down to $2,500. That's a middle-class tax increase, isn't it?
That's correct, and also health savings accounts. I've used a health savings account, and in 2 years, for folks that don't know what that is, you make a deductible, whatever it happens to be. Mine was $5,000, a highly deductible plan, high-cost plan. At the end of those 2 years, I had not spent $7,500. I got to keep that. 84% of the employees in my medical practice do that. Now, let me also point out one of the things that worries me a lot about this mandate of health insurance that we're talking about, which is what Massachusetts had. If we have an 8% mandate on business, and after 3 years, any business can opt into this public option, what incentive, if the commissioner approves it, that is true, what happens to a company that then decides, I don't need to raise salaries, because if I raise salaries to my employees, I raise my cost of health insurance?
All right, first of all, let me just correct. It's a common misconception. First of all, 84% of all businesses are going to have no sanction at all. Anyone with a payroll less than $500,000 not going to be required to cover. And it's only going to be individuals that don't have insurance that are going to go into the public option. And if you're against competition, you're not going to like this bill because we're introducing competition. But the fact remains, you can have all of the fancy savings accounts you want. If the rates for insurance go up and up and up and people can't keep up, it's not a function that they're not saving enough enough money, the cost of insurance is going up 3 times our rate of our salaries. It's simply unsustainable, and we're trying to protect American citizens from that.
Representative Weiner, what are the chances? Let me ask Representative Weiner first and then Representative Rowe. What are the chances this thing gets through?
I think it passes. I think it passes because overwhelmingly the American people support it, and I think it passes because, frankly, you know, we are not the perfect feedback model here in Congress, but when pushed into a crisis situation like we have now, we Democrats were put in charge to try to get this done. We're going to do it without a single Republican vote, and that's regrettable.
Dr. Rowe, by the way, everybody has their own polls. I mean, Fox News has polls, Gallup has polls, Rasmussen.
Sure.
It's virtually impossible to know what the public thinks of things like the public option, isn't it?
It's not virtually impossible. In the 1st District of Tennessee, they don't want it. And I can tell you they don't want it overwhelmingly. And one of the reasons, look, we want health care reform. Look at 4 or 5 things you could do that wouldn't cost much money. Eliminate state boundaries. Just like he and I can buy our health or car insurance, eliminate state boundaries. Let's do that. Let association health plans actually compete. You can do that. There's nothing in this plan right here, this massive plan, that helps prevention. As a matter of fact, the Medicare cuts, where Medicare Advantage is good, is it does look at preventive care. You can do that to help cut costs. Tort reform. One other comment I've got to make before we go. There isn't anything in this bill about tort reform. Yes, there is. And guess what it does? It does not limit attorneys' fees, nor does it have caps. And
quickly,
those are 2
Representative
things you've got to do
Weiner,
to get
just to counter that, if you could, very quickly.
Well, sure. First of all, we added a section about tort reform. It's a big bill. Maybe he hasn't gotten to it yet. He has 72 hours now not to read it. Maybe we can get right to that. But I'm going to tell you something. There is no health plan in Tennessee that is even asking to offer to people in New York. We have thousands of policies available in New York. There are very few available in Tennessee. We've dealt with that we're taking away the antitrust exemption that allows the insurance companies to operate with impunity. We're doing something about this problem, and my friends, the Republicans are frankly haven't yet to show us their bill.
I've got it in my pocket.
I'll take it.
You can fit it in your pocket. Holy cow.
Matter of fact, I've got it right here.
Guess what, Anthony Weiner? I prefer 2 pages to 2,000, but
this is it right here.
Well, if you prefer 2 pages, my brother, you would never make it in Congress.
You got it right here. This is it.
Remember,
my wife will be happy to hear
the
that.
TARP was 2 pages initially, and we know what happened there.
She's got a great point on that
I can get it down to
Okay.
2 pages for my press release, too.
All right. We're glad you all
Thanks,
remained
guys.
unscathed. Dr. Phil Rowe, Anthony Weiner, great to see you both. Thanks very much.
Thank you so much. All right, how will this latest